Hey there. This episode of Straight Talk with Tammy Consejo is about clinical depression. What is clinical depression? We tend to use the word pretty loosely, like I'm depressed about this or I'm so depressed about that. And in most cases, we're not actually talking about clinical depression. Clinical depression is a medical condition. What it's not laziness. So when somebody with clinical depression is struggling, often they'll hear things like, just ignore it. It'll be fine. Pull yourself up by the bootstraps, or don't be a wimp. What else? Just do it. Just do it. You'll be fine. Mind over matter. So these things actually don't work. Clinical depression is a real condition that may or may not need medical and or mental health treatment, but it's not as simple as willpower to get better. So there are about 3 major levels of clinical depression. So mild, moderate, severe. Today I'm going to talk more about severe depression as part of the series about suicide. So someone with severe depression may actually consider taking their own life because the pain is agonizing and it feels like it's not survivable sometimes. So where does it come from? Well, different places. It depends. Sometimes it's in the good old DNA. It comes down through the genes. And doesn't mean we will have an episode of clinical depression if someone in our ancestry line did, but we're more predisposed to it. Sometimes it's situational. So somebody that doesn't have this kind of genetic marker still may have something really horrible happen, and that can trigger a depression. Sometimes it's trauma. Traumas can be a lot of things. It might be a one-time trauma, or it might be an ongoing trauma that happens over a long period of time. And then there can be hormonal changes. Certainly when adolescents are going through puberty, when folks are older and their bodies start changing again and the hormones start changing, that can trigger a clinical depression. So it's just important to understand that there could be a variety of reasons. Some of you, especially, I'm making this video in Vermont, where we've probably heard of SAD, S-A-D, seasonal affective disorder. This is a kind of depression that some folks get when they're in a dark climate. And Vermont and other northern states certainly have long periods with less sunlight. So it might be seasonal affective disorder. That doesn't mean all seasonal affective disorder is in the winter and darkness, though. It can happen in any season, even in the summer. It really depends on the person, what does and doesn't potentially set it off. So what I'd like to convey here the biggest point is it's real. And there are some things that we can do about it. So there are other videos on this channel that you can refer to. For example, there's one about signs of depression, and then what to do if you think somebody you know, or if it's you, that is thinking about taking one's own life. So I hope this was informative, and I encourage you to follow this channel and check out the other videos along the way. There's a whole bunch about just navigating the ups and downs of life. Talk to you soon.